Thank you very much, Mr. Chairman. Since joining the Ways and Means Committee, I have made it a priority to focus on protecting Medicare from fraud and abuse, specifically in hospice care, where patients and families are at their most vulnerable. This has been, by the way, a bipartisan effort. Last Congress, I had the privilege of working with former Congressman Blumenauer to raise bipartisan concerns, to conduct oversight, and to push for stronger accountability at CMS. Because at the end of the day, protecting patients and preserving the integrity of Medicare should never be partisan. Medicare is a commitment, and when fraud enters the system, that commitment's broken, not just for taxpayers, but for the individuals and for the families who depend on honest and appropriate care. We have seen bad actors that are exploiting gaps in oversight, enrolling patients in services that they don't need, and diverting resources away from those who truly rely on them. Ms. Clark, what are the top 3 changes that you think Congress and CMS could make to ensure that beneficiaries who have been victims of fraud can quickly correct the situation and have access to the care that they actually need?
We need to do more education up front to teach them when an election is made, who to contact. As Dr. Lynn said, they have to know where to go to. Who do I go to when I have this problem? And if it's 800 Medicare gets them over to Senior Medicare Patrol. So giving them the information to make that informed decision is so important. But then, once it's identified, we need to immediately make them whole again. And they need to be, and we are at 24 to 48 hours now with the rapid disenrollment program. Once we identify it, either Senior Medicare Patrol or CHAPCA, we work in tandem, and we get that information up to CMS, CPI, and they get this beneficiary's life back, and they get them their services that they need. What we need to do better is how do we figure out then that there's a consequence there? As I had mentioned, you have that spend on that beneficiary, and we need to get that record back to 0. When that beneficiary says, I have been scammed, I do not know who they are, that they are made whole, but then that beneficiary's cap needs to be set back to 0. Because if we don't, who's going to take care of them?
Last week, I asked Secretary Kennedy about the steps that HHS and CMS are taking to crack down on fraud, and that cost taxpayers just hundreds of millions of dollars. And I was encouraged that he at least recognized the building that housed over 100 hospice providers, something that, by the way, Secretary Becerra was unable to do. Looking back, you mentioned that officials from the Biden administration met with you for 2 days. What came out of those meetings?
Well, as I mentioned, the first day we had given them a plethora of information on what we were seeing, and stories similar to what Dr. Yanni had, and had them work with the Department of Public Health, work with the Department of Healthcare Services. They said it's some of the best meetings they've ever had. They downloaded everything that we were seeing in California.
Well, and just to clarify, I mean, HHS had authority to notify the beneficiaries when they enrolled in hospice, but they did not do so under the previous administration. No. So now under Dr. Oz, that notification is being implemented, but do you know why that action wasn't taken earlier?
I have no idea.
So I'm working on legislation to actually help CMS better target oversight using some data signals. So I'm just going to kind of give you just 4 questions, and if you can just say yes or no. Should certain red flags automatically trigger increased scrutiny? So a hospice that fails to submit quality data?
Yes.
Rapid or recent change in ownership?
Yes.
Provider overdue for required surveys?
Yes.
One with an unusually high rate of live discharges?
Yes and no. I would look at the hospices that nobody dies.
Okay. And do these indicators suggest potential fraud, and should CMS be using them more aggressively to target oversight?
When used appropriately and in the right way, yes. You can identify the scammers and the bad actors.
Awesome.
Yes.
Thank you very much.
Used appropriately.
Thank you very much for your testimony.
You're welcome. Thank you for all you've done for hospice.